Welcome to Doctors on Call. I'm Jenna Miller. We've all heard the advertisements and news about the new weight loss medications. Despite the costs and side effects, drugs such as Ozempic have risen from obscurity to popularity thanks to social media and celebrities. Many individuals have not had any options for weight loss besides surgery or lifestyle changes. So who is a candidate for these medications and what happens if you stop taking them? We'll discuss these issues and more on Doctors on Call with our guest, family physician, Dr. Micca Schneider.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Micca Schneider graduated from Great Bend High School in 2010. She earned her bachelor's degree in cellular biology in 2013 at the University of Kansas, a medical degree in 2018 from the University of Kansas School of Medicine in Kansas City. Dr. Schneider recently graduated from her Wesley Family Medicine residency in Wichita. During her residency, she was named supervising resident for adult medicine, inpatient pediatrics, and obstetrics in 2019. Her memberships include the American Medical Association, American Academy of Family Physicians, and Kansas Academy of Family Physicians. Dr. Schneider is on staff at St. Rose Medical Pavilion at the University of Kansas Health System in Great Bend, where she also is full spectrum medicine, which includes delivering babies. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for being our guest tonight, and we got lots to cover, and this is kind of a newer topic in a way. Let's first of all talk about how does a person's weight affect their overall health?
So we know that over 41% of the American population is obese or overweight, so almost half of Americans. So this is a big issue for everyone, and we know that if you have more than a 5 to 10% excess of weight gain, you're at increased risk for high blood pressure, diabetes, and those can lead to worse problems like heart attacks or strokes or decrease the quality of your life and earlier death.
Sure, absolutely. Now, how might a person know that they have an underlying health condition that is causing weight gain or the inability to lose weight?
So it's kind of like what you talk about. You have that inability to gain weight, or you go to the physician that you see on a regular basis and they say, hey, you have high blood pressure, or your blood sugars are elevated, or you just can't seem to lose the weight even though you're working out 4 or 5 times a week and you're trying to eat all the right and healthy things and it's still not working.
Sure, absolutely. Then what? What should a person do?
So we always kind of, again, start with lifestyle and diet modification. So say someone comes into my practice and says, hey, doc, I'm trying to lose weight. We always talk about, what are you eating, counting the calories that everyone talks about, portion control, getting out and exercising. They always recommend at least 150 minutes of moderate intense physical activity per week. And once you've done that for 2 or 3 months, and if you're still not seeing any changes, then we say, okay, what's the next step? Is that oral medicine or is that injectable medicines? And then we kind of go through that based on each individual patient.
Okay, let's jump right in. What is a GLP-1?
So the GLP-1s, these are the injectable weight loss medications that were initially for diabetes, and they found that during this time that, hey, they also help with weight loss. But they're called glucagon-like receptor antagonist. So what those do is they're in various parts of the brain and in the body. So they tell us, what are we craving? How are we digesting our food? Are we regulating our blood sugars? And is our pancreas helping regulate our insulin amount? So we found that by modifying this with medications to kind of act like our body's hormone that does this, we can delay gastric emptying to make you feel full longer, or help your blood sugar stay low, or make your body more sensitive to insulin, or again, turn off those hunger cravings and say, hey, I need to eat all the time.
Sure, absolutely. Now, who would be considered a suitable candidate for weight loss medications such as the injectables? We also hear about Wegovy and Zepbound.
Yes, so the 3 weight loss injectable medicines, so that's the Saxenda, so that was the first one that came out. That's a daily medicine. The Wegovy, that's the weekly injectable medicine, and lately they just came out with Zepbound, so that's a combination of 2 hormones together to make it even more effective, and that just got released this fall. But the people that would be candidates for anyone that's obese, like we talked about, almost half the population, so that's considered a BMI greater than 30. And then there's also other candidates would be anyone overweight, which is a BMI greater than 27, with any other medical conditions with that. So high blood pressure, diabetes, obstructive sleep apnea, fatty liver, or high cholesterol.
Sure. Now you mentioned BMI. I know there's some maybe conflict of what, if it's outdated. Let's talk about that a little bit.
So this has been around for a long time. So all it essentially is it's your weight and your height. So it doesn't take into account if you're a football player or a bodybuilder or someone that's very skinny, you may have a healthy BMI, but if you're not physically active and you're not getting a regular amount of exercise and doing a regular diet, that could be the skinny fat that it's a normal BMI, but not necessarily healthy. Or you could be someone that you're a bodybuilder, you're exercising 4 or 5 times a week, but your BMI says you're obese just because of your height and weight. So it doesn't take into account level of activity and muscle mass.
And so if a person has a question about that, what do they do? Go to their doctor to ask?
Yes, typically go to your doctor. You can go to health facilities where they'll do like pinch test or they'll measure your body fat and things like that. So there's various ways you can do it that's usually a little bit more accurate, but it's harder and very individualized.
Sure. Well, we have a question that was emailed to us. We want to get to that. This is from Renee, and she says, I'm doing stomach crunches and have lost several inches. I'm noticing the weight loss is at a standstill. How long will it take to see some more weight loss? She exercises twice a day.
Okay. So typically what I tell for anyone, it takes about 12 weeks of solid change in activity to notice. So if she's noticing she's losing inches, great, she's on the right track. What I also tell people is doing the same type of activity every day, your body starts to get consistent with that and you don't burn as many calories as you did the first time you did it versus the 50th. So I always talk about variety, changing up the diet a little bit, changing one little thing every week or changing the activity that you do one little week. So if you do a regular walk around the park, walk the opposite way, walk counterclockwise versus clockwise, or throw in some sprints in between that. Or if you're doing just cardio, throw in a day of weights or vice versa. If you're doing weights, add a day or two of cardio to keep your body guessing so it doesn't always know what it's doing. So it's always ready and prepared and burning the most calories that it can.
Okay. Now, Renee did not mention anything about her diet, but she is obviously having some success. What would you add as far as what she could be doing with her diet?
So typically what I tell people is it's always calories in, calories out, but it's also making the right healthy choices too. So I always talk about portion control, making sure that my healthy plate, half a vegetable, a quarter of the plate's kind of a protein, and a quarter of a plate's like a fat or a carb. And just kind of, again, varying up the diet. If you're eating just chicken breast and salads every day, your body's going to get used to that. So switching it up, changing your meats, changing your proteins. And if she's exercising that consistently, she may not be getting enough protein for her weight. So usually we recommend about a gram of protein for a kilogram of your body mass. So a normal person may need 90 to 100 grams of protein, and not a lot of people get that unless they're actively trying.
Sure, absolutely. Okay, we're going to go to the phone lines. We've got Carrie on the line from Salina. Hi, Carrie. Go ahead with your question for Dr. Schneider tonight.
Hi there. I have a 15-year-old daughter who is obese. She keeps asking me about Ozempic. At what age can kids start trying this medication?
So typically we have started patients as young as 14 on the injectable weight loss medications. It's typically either the Saxenda or the Wegovy versions. So Zepbounds, they mainly make it for adults, but if you go see your doctor and you have that BMI greater than 30, she would be a candidate.
Okay, now Carrie mentioned Ozempic. Of course, that one's gotten really popular because of celebrities and whatnot using that. But you've also seen some of them getting results very, very quickly. Is there any danger to that, losing weight too quickly?
Not necessarily. You just have to keep an eye on, that rapid weight loss can cause changes with obviously your body. Sometimes they notice an increase in heart rate with some people, and some people will notice rapid hair loss too, but that's not necessarily an adverse reaction. The hair will grow back over time as you maintain that body mass, but it can be seeing clumps of hair in the shower may be scary for people. It's just your body's a stress response because it's not used to using that much weight so quickly, but even a 5 to 10% weight loss has definitely more benefits than risks at that point.
Sure. Now you've mentioned that they're injectables. Explain how that works.
So depending on the injectable, like we talked about, Either it would be a daily injectable where you inject either into your stomach, the fatty parts of your arms, or the anterior aspects of your thighs. Or some are weekly medicines. So the way it works is it kind of based on the compounding of the way they made the GLP-1 is how long it can last in your body. And that kind of decides if it's a daily versus a weekly.
Okay. What are some of the potential risks associated with these injectable GLP-1s?
So one of the main way it works is it helps delay gastric emptying. So the problem is that if you eat, sometimes your stomach stays in your food stays in your stomach for a longer period of time. So about a quarter of patients will endorse some nausea, vomiting, and then others will have other GI side effects such as not being able to go to the bathroom, so constipation, or going too much diarrhea. So typically I tell patients about 1 in 4 will have those, and that's why we typically start them at the lowest dose possible to minimize any side effects you have. And at the same time we tell them, when you start these medicines, have smaller meals a little bit more frequently and limit the amount of processed foods or high fat foods to maybe limit that nausea and GI side effects from happening.
Sure. Now, on the flip side of the coin, the positive side, let's talk about the key benefits of using Wegovy and Zepbound compared to other weight loss medications.
So typical weight loss medicines will typically give you about a 5 to 10% weight loss. These injectable medicines have made that so the average would be about 15, and with the latest Zepbound up to 21%. So essentially you're doubling what you can do and maintaining that for a long period of time. So maybe the medicines or the oral medicines that didn't work for people in the past, these are more effective for more people.
Sure. And what long-term care considerations should individuals on these medications be aware of?
Well, we always say is we want to treat obesity like a chronic condition, like we would treat your diabetes or your blood pressure. So as with blood pressure medicine, just because we get you to a normal blood pressure doesn't mean that I'm going to stop the medicine. And if you get to a normal weight, typically when people reach that goal weight that they want to get to, we'll say, hey, look, we can trial spreading these medicines out. So instead of maybe taking it once a week, once every 10 days, every 2 weeks. But if you start to have a weight gain of more than about 10% of that weight gain back, we say we have to go back on the medicine. So long-term effect is this may not be a get to goal weight and then you can just go off of it. This may be a lifelong medicine. And if not, there is that high risk of weight gain back to previous BMIs.
Sure. And can a person take the injectables and not change a thing they're doing and it still work, or do they still need to make a little effort, if you will?
I always say it's a tool. Yes, it's probably going to be effective because, again, we say that 15 to 20% weight loss. So no matter what you do, it's going to give those negative feedback. So even if you try to eat a ton of food, your body's going to say, my stomach can't fit that much, or I get constipated. So it's going to give you those negative feedbacks to say, you can't do this or you're going to not feel well. So you could do that, but you may not get as much weight loss. So maybe you only get 5 to 10% versus that 15 to 20. But if you eat healthy, exercise on a regular basis, and do all those right things, you're going to be on the higher percentage of weight loss.
Sure. And are these injectables covered by insurance?
So that's hit or miss. So I always tell any patient that wants to come in and talk about weight loss medicines, check with your insurance first. Say, hey, does my insurance cover weight loss medicines in general? Or do they have a specific thing that they would only cover Wegovy or only cover Zepbound? So that kind of gets us started. Right now, Medicaid and Medicare really aren't covering the injectables unless you have a supplemental D plan on top of that they have specifically for weight loss. And I have some patients that when they get on Medicare, I want plans that specifically cover for X, Y, or Z medicines so they can kind of try and pick and choose to get that. But every insurance is different and every year it changes.
Now, does a person have to have or be diagnosed with diabetes in order to get a prescription for these?
No. So anyone greater than a BMI of 30 or above is a candidate, and anyone greater than a BMI of 27, and if they have another condition like we talked about, so diabetes, high blood pressure, obstructive sleep apnea, or high cholesterol, those would all be candidates too.
Okay. And going back to whether or not it's covered by insurance, let's say it's not, and a person just wants to pay out of pocket. What are they looking at?
So average cost would usually be about $1,000 to $1,200. Sometimes the companies or the manufacturer will offer coupon codes. So say your insurance doesn't cover it, they may cut the price in half. So if you get a coupon card, instead of it being $1,000, it may be $250 to $500, depending on the coupon that you get.
And we're talking per month?
Per month.
Okay.
Yeah.
Okay. Sure. Now, we talked a little bit about this, but maybe go into a little more detail about what happens when a person maybe stops taking the medication.
So after you stop taking the medication, typically the first thing people notice is they get those hunger or those appetite cravings that I need food, I'm hungry, and they kind of want to eat more often than maybe they did before because that medicine is calming those cravings and increasing the amount of fullness they feel. So they don't eat as much, so they may start eating more and more than they did before.
Sure.
So again, rapid weight gain, and then if they were able to get off blood pressure medicines or diabetes medicines, those may return. So blood sugars may go up, blood pressure may go up, and then more fatigue or obstructive sleep apnea may return, or they may get fatty liver. So all of those things can return.
Now, are these medications, are they relatively new, or are we just now really hearing about them?
We're just now hearing about them. The first medicine that was a GLP-1 was founded in 2005. The first time it was used necessarily for weight loss was 2014. So it's been around for over 10 years for weight loss in general, and almost over 20 years for diabetes in general.
Sure. And is there any concern about negative long-term effects if this is, relatively new as far as weight loss? What are you hearing about that?
So we always have contraindications. So people that have medullary thyroid cancers or conditions called MEN1, multiple endocrine neoplasia. In rats, they noticed that they did develop thyroid cancer from that. So that's always a risk that we look for. And another long-term risk could be if you're on it for a long term, or even if you've been on it for a year or 2 years, there's always the risk that you could have problems with your gallbladder or problems with pancreatitis. And those are kind of big, serious conditions that we look at and worry about. So that's why they kind of always will check labs and always talk with your doctor about any side effects or any concerns you'd have with it.
Sure. Now, where they are injectables, I'm assuming you have some patients that might be a little leery of doing that. Explain how you might calm some fears.
So the weight loss medicine, they always come in and they give us kind of sample pens. So we get to show them, this is what it is, this is how easy to do. It's a twist, click, you press it in, you hold it for 10 seconds, and then you're good. Typically, you don't even feel the needle going in because they have surrounding areas that kind of numb or dull the pain and make it so you don't feel that you're actually getting an injection. So people are like, oh, I didn't even feel it. So
excellent. Okay. Now, do you find that there's a stigma sometimes attached to a person attempting a different approach to weight loss, such as these injectables?
There's always going to be people that say, oh, you took the easy way out by using a medicine or a surgery, but everyone's different. If we would have figured out the same thing that would help everyone for weight loss, we would all be skinny and fit and know exactly what we're doing. So I think to each individual person, you have to do what's right for you.
Sure. And when you first start on the medication, typically how long until a patient sees results?
Usually within the first month, you'll notice about a 5 to 10% or a 5 or 10 pound weight loss. Initially, it's very quick. And then over time, it may slow down as your body gets used to the medication.
Sure, absolutely. And then you had mentioned about, people saying, oh, you took the easy way out. Not that it matters what somebody says, but is there more to weight loss than just good old-fashioned willpower?
I think so, and we're learning there's more genetic conditions. As you see, it may run in families that someone may be skinny and have the best metabolism, even though they may eat unhealthy foods. And then you have that person that they're working out 5 days a week. They're doing everything right, and they're still overweight or obese. And common thing, especially for females, is something called PCOS or different types that make it harder for you to lose weight. And something that may work for one person may not work for another person, which is like, oh, I lost all the weight doing this, so trying what was successful for one person may not be successful for you.
Okay, what do you tend to hear from your patients when they talk to you about a weight loss program or a solution? What are their main concerns? Essentially, is they usually come in because they've tried it and nothing is working. So, I just want to lose that 10 or 15 more pounds, or I'm tired of feeling tired. I'm tired of needing blood pressure medicines. I'm tired of needing diabetes medicines. I want to be healthy, but things I'm doing aren't working. So I think it's the frustration of they're trying, they're putting in the effort, they're doing the work, and it's just, they're not seeing the results. And how do you feel about getting on the scale? There's differing opinions as far as you should get on the scale every day. No, don't do that. Some will say, hey, if I wouldn't have, gained a pound, I wouldn't have gained 10, if I would have kept track. What are your thoughts on that? I typically say you should probably get on the scale no more than once a week. Now, do people do that more often? Yes. Have I done that more often? Yes. It's about how that weight is going to affect your day or affect what you do.
So if you're a person that you get on the scale and that weight determines how happy you're going to be or what you do that day, I say you probably should make that a daily thing. Do it once a week so that you're not on edge or not always thinking about counting the food or counting the calories or, oh, I gained 5 pounds, I can't eat today. You have to have kind of a healthy balance. So if you can healthily look at your weight every day and say, okay, this doesn't change. I mean, it keeps me on track, it keeps me on goal, but it doesn't dictate X, Y, or Z of what I do. I think that's fine, but typically you won't notice fluctuations day to day. More likely week to week are going to be more accurate goals of if what you're doing is working.
Sure. Would you say there's a science behind weight loss?
Yes, I would think there is. And, we're still trying to figure that out. We've been working on this for several years and everyone's different. So the science for one person may not work for another, but I think we're getting closer to realizing that this is a disease that we need to treat and regulate just like we would diabetes or high blood pressure. So obviously starts with, a fairly healthy diet, fairly regular exercise, and then adding things on top of that if needed.
Sure. And there's some weight loss programs out there that work really well, but this moment a person gets off, they tend to, gain more weight sometimes. Why is that?
I typically think about, if you want to look at weight loss, you have to look at it as a lifestyle modification. What is something that you're going to be able to do long term? So people that go on juice cleanses, yeah, you may lose weight for 3 or 4 days, but then once you start eating again, that's going to come back. And the same thing with if weight loss is like Weight Watchers or things where you buy food or Slim Fast, those diets. So they calorie restrict, but you have to keep doing that sort of calorie restriction and eating those types of foods to maintain that loss. So if you get off of those type of diets or exercise regimes, the weight typically will come back on because you stopped doing what was effective for you.
Sure. And at what point might surgery be an option for a person looking to lose a significant amount of weight?
I typically will look at my patients, and if they have about 100 pounds or more to lose, I have them consider, I'm all for, diet and exercise, but we found that it's rarely able to get above that 100 pound weight loss without needing some sort of surgical option, whether that be the gastric sleeve or the gastric bypass.
Sure. Does a person still have to change their eating habits, their exercise habits after surgery?
Of course, yeah, because it forces you to change the way you're eating. So if you may be able to get down a whole pizza before, you may only get a small slice of a pizza before you feel full. And kind of the same thing of what the injectables do. They force you and they make you feel unhappy if you try to cram more than a slice of pizza down. Your stomach's going to say, hey, we can't go down. It's going to go back up. So over time, you kind of learn those cues of, no, I can't eat what I did before and I have to eat those healthier options, or my stomach's going to tell me, no, you can't do that. We don't like that anymore.
Sure. And we talked about how quickly you can start losing weight after, starting the injectables. What about post-surgery?
Post-surgery, it's actually more. So people tend to lose at 15 to 20% of their weight loss of excess weight within that first 2 to 3 months after surgery. And typically, they'll lose about 60 to 75% of the weight loss within a year to a year and a half after surgery. And most people are able to maintain that long term. So what I tell people with the injectables is the injectables, like we talked about, as long as your insurance would cover it, you would be able to stay on those medicines. But like we talked about, if you go off those medicines, there's that chance for weight loss for weight gain to come back. Versus the surgery, you pay the one-time cost of the surgery, which may or may not be covered by your insurance. Typically, you lose 65% of your weight loss that you would need to lose, and then that's something that you would be able to hopefully maintain for the rest of your life.
Sure. Okay. Now, for some, losing the weight is easy, whether they're just doing good eating habits, diet, exercising. It's keeping it off that's the challenge. What do you want to say to those patients?
Kind of make it a lifestyle intervention. I tell people, don't feel like you have to start running a marathon right away. Make small little changes. So instead of frying food, baking the food. Instead of having a big old baked potato, maybe have half the baked potato. Instead of having a lot of sour cream or butter, maybe butter alternative, or just not butter or no bacon. Just making small little changes, or once a week having fish, or once a week having a salad. All those little changes that you can make that you can maintain will all build up over time.
Excellent. And what kind of support is available for a patient that may be going through a weight loss journey right now?
So it's hard to find nutritionists, but usually your doctor can kind of help you talk about good lifestyle interventions. So regular exercise, regular diet. There's online support groups. Facebook has been an amazing thing for these people with injectable medicines. And the telehealth since COVID happened. So sometimes you're able to find a nutritionist online to help you with that. So their network is getting wider and wider as Facebook and all these online options grow.
Absolutely. Wonderful. Well, thank you so much for joining us tonight.
Thank
That's
you.
Dr. Micca Schneider from Great Bend, our guest tonight on Doctors on Call. On our next show, we'll be discussing prostate and breast cancer. You can email questions for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.